Good afternoon, viewers. Welcome back to Campus Life Documentary. Today, we are on campus talking to students about diabetes. Many young people think diabetes only affects older people, but lifestyle and diet can also put students at risk. Let's hear what students on campus know about it. I am your host, Abdul Moksin, and I'm with.
Amina Adams. Hafsa Fasida Abdulaziz.
Abdullah Abu Hanifa.
Thank you all for coming. So, my first question is, what comes to your mind when you hear the word diabetes? I mean,
When you say diabetes is, to begin with, is an epidemic. It's something that is taking lives more than HIV, which will be surprising. Throughout the world,
Hello, hello,
people
hello,
spend
hello,
billions of money
hello.
trying to treat diabetes. From 1990 to 2002, research shows that diabetes has increased from 7% to 14%,
wow.
which shows how deadly it is, which it can be so detrimental in our society. People suffer from diabetes out of ignorance. Mind you, many people think diabetes is normal as you get old, as you said earlier. I like your introduction. It speaks much more about you. So diabetes isn't for older people
Older
only,
people.
but for all. No matter who you are, it can affect you, no matter your status. It's not being pinpointed to only one person. I think that's brief summary I can talk about diabetes.
Susan, what do you have to say about
Thank you very much. When we say diabetes, now most of the dead like the what is killing us nowadays is just this kind of diseases. But people doesn't take it into consideration because they think that it's normal. Eating is normal. But more to the point, if you check, is this a kind of disease that is now killing us more? So let's consider diabetes. Mhm. So they will always think diabetes is just to maybe something that it will go and like you can read.
it? You can treat it.
Yes. So they don't take it serious. Uh-huh. So but if you take this thing serious, the more you consider it, the better the
The environment will be for
yes.
us.
Yes.
This what do you have to say about that also.
Yeah, so I feel diabetes is more like a chronic condition where the body struggles to regulate blood sugar, and it comes in types. We have the type 1 and we have the type 2. We also have one we call the gestational diabetes too.
Okay.
Yes, I think these
So
are
please, do you have any difference between the type 1 and the
yes. So the type 1 is where the body is resistant to insulin producing cells,
okay.
and the type 2 is when the body is unable to produce the insulin. And the gestational diabetes too, it happens in pregnancy. Yes. So when you are pregnant and you get diabetes, we claim it's gestational diabetes and it goes away after delivery. But if you don't take time, in 2 years to come, if you don't take time, if you don't modify your diet, you can get the type 2 diabetes. Yes.
Thank you very much. So please, my question is, diabetes, is it only related to sugar or other food stuff can also give you diabetes?
Um, Diabetes is not only related to sugar.
Oh, okay.
Yes, diabetes, what I would say is more is related to our lifestyle.
Okay.
Yes, our lifestyle. Sometimes the genetic can predispose you to diabetes,
Okay.
but if you're able to manage the way you eat, the way you manage your lifestyle, the risk of getting diabetes will be low. Yes. And more often leading a sedentary lifestyle. Sedentary here means a lifestyle, these guys, they just a soft life, soft life.
Yeah.
So leading a soft life, eating caloric foods, high dense carbohydrate foods and the rest without doing any physical activity can predispose you to being obese. And obesity comes in predisposing you to various type of cardiovascular diseases, diabetes, as one, cancers and the rest. Yes.
So, in our society, if you hear diabetes, as I said earlier, people think it's just for those going old.
No sugar.
But there is this thing that we should be more conscious of. Although sugar plays a role, but it doesn't mean it's the only thing.
Okay.
Sugar is just for the layman. If you see someone outside, I don't know if you but now I know your knowledge in diabetes have increased.
Yeah.
If
Yeah,
you see
obviously.
someone say diabetes, normally in our local language, some people there's ACTRI, Chikudoro. So that's what people think of. That is only you taking sugar, taking sugar. As our sister said, type 1 diabetes, that one mostly is genetical. That one maybe due to your family lineage, you could inherit some genes that will expose you to getting diabetes. But type 2 diabetes, that one, and that's the most prevalent one in our society now.
Very dangerous.
In our society, and that's very prevalent. That's because of our lifestyle. We eat much and we do less. We eat, go to bed, eat, will not learn. And mind you, talking of you doing much doesn't mean you should just go and carry any cement bags and all those stuff. There are many things you could be doing that will help you. So diabetes is not only limited to sugar, but rather your lifestyle, then also your diet. As our famous scholar said, the father of medicine, you tell you that let your thy food be thy medicine,
Yes.
and thy medicine be thy food. That's hypocrite.
Hypocrite. Yes.
Yeah.
Yeah.
So I
What
think
you eat is what you see you eat.
Thank you guys for enlightening me on that because for me, I thought diabetes was only related to sugar. Thank you very much. My next question is: do you think the food students eat on campus can increase the risk of diabetes?
Yes.
yeah, as our sister said, I think she added before you put it to me. That's because of her knowledge in it. Some of us are ignorant about diabetes. That one, there's no two ways about it. Some of us are ignorant. We don't know what causes diabetes. So when it comes to students level, we take things so lightly. We think soft life is just about you taking big O, storm.
Pieces.
I'm not condemning people's product, but we are saying the facts. When you speak of diabetes, it comes in when we, as we said earlier, when you are not conscious about what you eat. Students in this case just taking what they get, maybe due to poverty and all those stuff. Yesterday, our lecturer was telling us that when you say poverty is you eating what you get, but not what you want.
Yes.
So at times we eat what we get. I don't know if you get the point.
Yes.
At times we eat what we get due to poverty, but not what we want. If it were to be what we want, maybe we could have getting mango, watermelon, and all those stuff. But some of us, it will be three months, if not even tasted what mango is. So diabetes students here, due to the food we eat, everyday gari, everyday gari, one way, then the sugar. No gari in this case is that some of the food that we take here mostly is not it's refined.
Yeah,
The food we take mostly on campus here is refined. If our rice here is polished, it's refined, which will make your blood sugar level increase so fast. Imagine when you have to take oats, you have to take oats and you taking rice, polished rice in this case. Which one do you get satisfied easily?
Conditions.
I think our dietitian here will correct you. Polished rice. Maybe you've not thought about it right. But taking oats, you can take 2 spoons of oats and you feel like you are getting satisfied. But if you talk of polished rice here, you can eat like a bowl, but you'll not be satisfied. That's because yes, try it. Do your research.
For me, oats doesn't satisfy me. That's
Wow.
why I said the polish.
I think we'll do research on
Oat
you.
is
Maybe.
a very good fiber that helps the body.
I also don't like oats.
Yeah.
I prefer Tom Brown to oats.
Yeah, the Tom Brown too
It's
is
also
So
good.
Tom Brown,
And,
Then I'm safe, right?
you are safe.
and you know, sometimes to the student, what is available is what you think is accessible. So sometimes where to get the nutritious food, the better foods, we don't get it. Especially this season, you know that like most of the things are not there. Like the vegetables, the correct, the fruits, they are not there like that.
Yeah.
So what they will get, the junk food and those things, that's where they will go for.
Someone will get the bread and
Uh-huh.
the you go
Like
and
this
you go.
fasting season, every day they will be taking bread every day.
We are all victims of that. Nowadays we are all victims. We are speaking from experience. You just feel like you're hungry. Then go and get some.
And the only thing you
More
can get is just the indomie, the spaghetti, the
Yeah,
some of
especially
them
when it's around 10 p.m.
yeah, that's
That's
when you
only
get.
food available.
Initially, it was supposed to be like they selling it and like tea late at night, so that if you are hungry, you can just go and buy.
Yeah.
Yes, in the oldies. But now all you see is indomie, spaghetti, and I don't know
Even our
whether
villages, even our villages are now upgrading.
Indomie Italia, like
Everyone
those
is,
stuff. Yes.
Yeah,
I
so,
think that's one of the most easiest food to prepare. So that's why.
Yeah.
so as I said, that's like I brought the
Just
poverty in
put
this
it
angle.
on fire.
Some of us, so let me throw this bullet to our parents out there. At times, if we are in school, they shouldn't think we are just there.
Yeah.
We feed. I know they care about that, but at times they should put in some more effort so that's in terms of our health. So if they make sure that if we are coming, we have our flour, that our seasoned flour. They shouldn't go and give us the refined one.
But sometimes too, the students they'll copy from their colleagues. Have you seen that?
So if your mother
Like
gives
me
you and you
last
copy from
semester,
your colleague,
I
that's you.
bring a flour, and I see that my colleagues are having college rice and those things. Next
And
time
next
if they are
semester
coming, they
also,
will
yes,
bring
I
it.
also challenge myself.
So now that's what we call
So
peer
like
influence
peer
and all.
influence.
That one is bad. So at times
All
it all
this
comes to it's a psychological problem in addition. So I think we should
Thank
manage
you.
our perception.
My next question is: do you think too much sugary drinks and snacks can cause diabetes among students?
wow, that's a nice question. Yes,
I
that's
So,
a
think
what do you
nice
guys have to say
question.
about that
You know those drinks.
one? Yeah.
That's what I said earlier. Like especially those that are predisposed to diabetes,
Yeah.
is low. But the more you take these things, you become addicted and you become a more
Diabetes.
yes.
It's
You
good to
be,
diabetes.
yes.
And even basically they will write on it fruit juice. And they are not using any fruit.
Yeah,
Yeah,
they are
there's
just
no,
using
they are not,
sugar.
they
Just
are
give
using
the
sugar
flavor and
and
the alcohol.
flavors. And that's very bad. Yes. You know, the more you take those sugary stuffs, the more you become like, let me use bloated, like as in becoming fat. And you becoming fat means you are being obese. And
Yeah,
obesity leads to what? Leads to
Diabetes.
cardiovascular diseases, diabetes, cancers, and heart failures, and the rest. Yes.
So,
So
so our sister is making some things here that I think we should break it down small to our viewers.
our understanding.
Cardiovascular, I
cardiovascular.
think talk about cardiovascular disease, that disease that
Yes,
attacks the heart
heart.
and our veins. So
Yes.
let's do some small physiology here in our body. If we talk diabetes, this sugar drink that we are talking about, you take in these sugar drinks, you take it, you feel like you are satisfied. Small time, you take something like this, you feel like you're satisfied. That's what will push us to a type 2 diabetes. That's because at times the body is being overwhelmed with too much calories. As our sister said that we are exposed to high caloric foods. So your body will be full with calories. Calories here is what we can maybe the energy, the glucose now. The glucose that we need. That's the basic form of energy that we need. So you feel like the body will feel like it's too much for me. Imagine the body being loaded above the normal level of energy that it needs. That's when the insulin that is produced, that's the insulin that will help you, the glucose go into the body. But in this case, the glucose, the one the body needs, is being taken. Now there's extra ones. Now it's being reserved. You take again. That one to come and pile up. You take again. It's come and pile up. So the body will take what it needs, and the rest will be there. That's when it will be putting stress on our body to produce insulin. And if it fails, or at times to produce right, it will not be enough. That's what we call the insulin resistance. That's what you the type 2 diabetes. Basically that's the physiology of type 2 diabetes. And taking this sugar drink that you are talking of, that's what it leads to. It leads to obesity. As I said, if the glucose is there for some time, it will be converted to fat.
So, sugar leads to obesity.
Yes,
Yes.
obviously. Look at
It's,
it.
it's not just sugar, it's the like carbohydrates in addition.
Oh, okay.
Starch.
It's not only oil.
Our
It's
body
the oil, yeah.
normally the sugar. That's what our body use. That's what we call the glucose. Uh-huh. So the more it pile up,
Converts to starch.
uh-huh. So the body will use the one it needs, and the rest will now be it will be
It will
there.
just be there.
That's when it will move to
Uh-huh.
triglycerides at the end. It will be
Yes.
the fat.
Yes.
That will be reserved for you later part if you need help. And here's the case: normally, now there's no hunger. It's our father's standard. There was hunger that you see somebody's neck. There was something we call rolling string. You'll be hungry. You see all
Yeah.
their ribs. But here's the case: all the time we are eating, and it will piling up, piling up, piling up. So definitely, the obesity will come. The fats will be loaded. So I think that's one of the key effects of these sugary drinks and all those stuff. I think you are speaking as if you are a professional in that food, but your questions are like straight bullets, going
Yeah,
straight
oh,
to
no. I also did science in SHS, so
so,
I have a little idea on
so your
that.
question goes straight
That's why
to
I'm
what is affecting students on campus. All of us, we are all victims, and we
No,
pay
yeah, all the things.
we all kill ourselves from that.
Inshallah.
Yeah.
My next question is, how often do you think students should check their blood sugar level?
I think it should be very often. Yeah.
Very often.
Yeah.
To estimate it like maybe 1 week, 2 weeks, or
It's
days.
Me, I will estimate it to a maybe 3 weeks
Three
because
weeks. After every three
me,
weeks.
I would
yes,
say months.
A month.
It's not easy.
I should
Like
also say mine. Me, I'll say every day. Because the thing is that and I say diagnosing the disease is part of treating the disease.
yeah.
If you're able to diagnose the disease, that's when you get to know that this needs an attention. But here's the case: you don't know what's going on. How can you treat it?
like some people don't even know like we
Yes.
have something like we call diabetes and you should check whether you are normal, you are
See that?
okay.
So
Yes, they don't
over
know.
59%, after 2020, 59% of adults uh, are not diagnosed of diabetes, but they have it. So some people have it, but they don't know. As we are sitting here, it will be shocking that we're going to check our RBSM, that's our random sugar
And the
blood
fasting,
sugar, and it shock you that we are suffering from diabetes, of which it can be reversed if care is taken. If you get to know it earlier, it can be reversed with diet and your lifestyle. But if you leave it and become chronic, that's when you can lead it to hypertension. Uh, it can lead obesity can lead to diabetes, and diabetes can lead to obesity. So they play hand in hand. In
Diabetes
fact,
can also lead to hypertension,
yes,
yes,
high
this
blood pressure.
yes,
Oh wow.
this because at times if your vascular that is said cardiovascular disease, if this insulin, if they are being overwhelmed in your body, this insulin can eat up tissues in your body. It will try to produce more insulin. But if this insulin are being produced and it's not getting the job done, to be corroding your body, it's like pouring acid on something.
Yeah, yeah.
So at times it affects our veins, and so the veins become constricted, become small. So the pressure that is supposed to move will increase. Imagine pipeline, a small pipeline, and the water pressure. I don't know if it's
Yeah,
explained.
I think I
yes,
understand.
That's
and
our promise. They will get to know that one very clear. So the pressure, you need much pressure to pump the blood, and that's where uh, basically that's hypertension. That's what it's leads to. So it's so crucial. Diagnosing it is part of the thing. So as regular as we can, we'll not give you this thing.
Okay. You are not going to estimate it.
I'm not going to
As
say
regular
as regular as you try your best.
So like
and, and you know,
35.
some people too like if they can go and check. You know, we have two types of the testing. We have the fasting blood sugar and the random blood sugar.
Oh, okay.
Yes. So the random blood sugar is just random.
Yeah.
So like that one is it?
Mm. The fasting is when you've
Yes,
not
I
eaten
know.
for
Like I want to.
about 8 hours.
Hours,
Then you go and
yes.
test it. So
Yes.
that's when normally you go to hospital, they tell you before you come tomorrow, you come.
You
If
shouldn't
you are coming,
eat
you
it.
shouldn't eat, then come. So
Yes.
that's the rationale
But
behind
the random,
it.
yeah, you don't need to. You just eat and go.
So they
But
will,
that one will not give accurate this thing to know like where you are. It
The
will-
random. The
Yes.
random will give you
Yes.
accurate.
But the fasting, there, if you're able to test for that one, you know where you are. Mm.
So students can do this checkup on campus, maybe at the hospital by a finger prick test through the glucometer. Yes, or also the continuous random check. That's the random, yes. So they can do that. They can check often to see their.
in fact, if you can afford it, you get the
They
test kit
can get it.
yourself.
Yes,
Yeah, it's easy to check.
It's
it's easy to check. Yeah.
If you get the glucometer yourself,
It's needle involved.
yes,
Yeah.
as
It's
I
they'll
don't
not.
prick
like
you.
it.
It's
I
just
don't like
breaking.
it.
It's
As
not.
in string, they will inject you.
No,
Inject
so
you.
far
No,
as there will be
They'll
I
pinch
don't
you.
like
it's just a
it.
small
just
prick,
I
like
don't like it.
malaria. The way
I
they
like
check
they check.
malaria.
So they
Yes.
just prick you
It should be
small.
painful.
Now,
Yes, small will be okay.
I don't
my
like
sister
needle.
here,
That's why.
my sister here can prick herself to check it. So
Oh,
be
okay.
if
fine.
she can do it, you can do
No,
it.
no, for me, I can't.
You can do it.
I don't like needles. I can't do it. So my last question is, what advice would you give to students to help prevent diabetes on campus?
So
Uh, prevent diabetes.
Yeah.
Yes. Like that's what we're all praying for. Like that's what we want. So diabetes, what I would say that is that they should like reduce the intake of those junk food, sugary drinks. If they can't stop, at least they should reduce. It will help. Yes. And also those refined foods, buying of, like, me, I'm suggesting that they should cook instead of buying outside. Mm, what you cook, oh, you know that at least this is what is inside. If you buy outside, you don't know whether it's refined or. I hope
Yeah,
you are
at times
getting.
your tongue will tell you that it's refined.
No, but some they don't know.
But some don't
They
care.
don't care.
Some don't care.
They
They're
are just
ignorant
to
about it.
full their tummies and be free.
You know.
Mm.
Yeah, so I think students should stop leading a sedentary lifestyle, and they should make sure they balance their energy intake and energy expenditure. So we have these two types of energy balance. We have the positive energy balance, where we deal with like what's the name? The energy input being more than the energy expended. That's what you eat. You don't expend it. You just eat and rest and lead a sedentary lifestyle without expending. We have the negative one where you balance it. Maybe you eat and do exercises to balance it. So you should try as much as possible to, as you eat, you take it out. As you do some physical activity. Yes. So that's my advice.
Thank you. Abi, what do you have to
Yeah, I
say?
think they said all, and I, as someone for you, we are where you are a baller, a footballer. You play football, and yeah, so yours in a way will be better than we do. Soon we will eat and sleep. So the first thing I'll say is our exercise. We should take our exercise serious. If you can't do anything, at least just get some small jogging for yourself. So 30 minutes. In 3 days, you get 30 minutes for yourself. That's what the beginning of 30 minutes. Get rid.
The
Uh,
whole day.
like 30 minutes in a day, 30 minutes for yourself. That's we are just starting. I don't want to be like we are overwhelming our body. So if you start gradually yourself, you feel like let me do more. And also our talking of in as much as our exercise level helps, our diet also helps as our dietitian here rightly said. You have to be careful about what you eat. What you eat is so crucial. What you eat speaks more about who you are.
Yes.
If you are fond of eating noodles here and there, I think trust me, you are exposed to diabetes. You can I can just look at you. If I track what you eat, I can say you are diabetic. What you eat and what you do, I can say you are diabetic. Not as in boastful, but as in the fact. That's what it is. Imagine you eating every day. You in the morning you took spaghetti. Afternoon you took what? Spaghetti again.
Wait,
You-
wait, wait, a drink.
Drink. So let's use the drink here. You took coke. Then you
Cook and
added
bread.
bread. You see it. Then the evening time you took what? Tell me what you used to eat. Fried rice. That
Fried
one.
rice,
That one. You go for your
shawarma,
shawarma and all those
pizza.
pizza. You see, so those ones, as we said earlier, that is the high caloric foods. You should go for those food with high fiber. Our TZ, we shouldn't refine it, the flour.
Yes,
You
yes,
should go for the traditional TZ. That's the one that they will not go and remove the fiber out, the husk. I'm saying husk. They will not go and
Charles.
remove the chaff out. Let the chaff be there. It has a role. Thank God it's left that you added the chaff to it and you go and take it off and you think you'll be fine. So we should be mindful of our food, especially the refined food. We should be limited to the unrefined food. We go for the healthy diet. Our vegetables and our fruits should be a key component of our food. And with that, I think we can do better
and you know,
on our health.
our stress management,
Stress.
very important. You know, some people can be awake calm. At least you should get 6 hours of
TBB.
rest.
We are
If
going
you
to get
can't
to
improve, at least meditate. You can lie down, just lie down soundly and on
yes.
your bed.
It may sound rare. It may sound
And
so funny,
Ridiculous.
but
And
it's
you know,
so
there are
crucial.
sometimes things that affect us. Some will leave their lights on, others the bed will not be conducive for their rest. That one is important. So at least if you are to sleep, you off your light. Because some people they can be there by the time they realize, oh, it's like I'm hungry. They'll go and pick food. After eating, they are lying down. The food cannot
Very
digest.
true. Very true.
We the men will be better than you guys because we will eat and we do some
I'm a
argument.
victim of what you just said.
I'm saying we are better than them. We will eat and we do some arguments more.
Okay,
So we exhaust some energy. Not I'm not justifying our own, but these people their own.
No,
They eat and they go back to the bed.
No, no,
I
no.
also make calls like
Your sweet course.
Course.
Your sweet course.
Love course.
I think that basically that's what. If you are conscious about this, I think we can manage it in a way. It's something that if you are not careful, a time will come. We all will be in the hospital as a result of diabetes. If you manage like this, our health facility will not be choked. If you take three of us, out of three people, two people will have diabetes. We're exposed to diabetes. That's pre-diabetic.
And now, if you go to the hospital, that's most of the cases. Diabetes, those chronic diseases.
And it will lead that what will lead you to stroke. And all
And
those
you won't
things.
be surprised. You see a 12-year-old boy, girl having diabetes. Being diabetic. Yes. Yes.
Okay. And do better.
Thank you guys very much for sharing your opinion on the topic diabetes. And thank you for sharing your views with Campus Life Documentary. Diabetes is a serious health condition, but with healthy eating, regular exercise, and proper medical checkups, it can be prevented. Let's all take better care of our health on campus. Thank you very much.
Thank you.
Thank you.